Can you tell us your name, please?
Hi, I'm Kayla Mendes.
And you're okay with us using this video for research and promotional purposes?
Yes.
Fantastic. Can you tell us why you sought medical attention to begin with?
I had a bunch of complications from ehlers danlos syndrome, which is a connective tissue disorder.
And the complications were?
Mostly in the GI tract. I had chronic nausea and abdominal pain. I had daily vomiting and diarrhea, occasional constipation, absorption issues, and abdominal seizures.
And you had headaches as well and issues with your menstruation?
Yes.
What was the menstruation like?
It was chronic stabbing. I would be bent over in bed for 2 days. Even during my ovulation, it would be the same. I could barely function.
And what were some of the other symptoms that you had?
I had skin rashes. I had allergies. I had the headaches.
And I had on here too night tremors, seizures,
Yes.
right, joint pain, muscle pain.
And
Can you-
fatigue. That was really bad too.
Fatigue. Yeah, we were having issues with brain fog and memory, correct? And depression. Can you tell us a little bit about the POTS?
The POTS, I had very high heart rate, and then my blood pressure was always low. So it was hard to stand up. I would black out with my vision, and my hearing would go. And sometimes I would just collapse to the floor.
And on a scale of 1 through 10, 10 being take me to the ER, how bad were some of these issues?
I was on a daily 7 to 9.
How many times have you been hospitalized?
6.
How many medications have you been on?
My most was at once 10. Right now I'm on 4.
And how old are you?
I'm 24.
That is way too many medical issues for someone your age. That's enough for a lifetime, probably. Okay, and at one point they even installed a gastric neurostimulator in June of 2018, correct?
Yes.
Okay, and you started seeing us in July of 2018, right? I am an acupuncturist and doctor of oriental medicine. We do some functional medicine as well and supplementation. You started working with Dr. Forgani in September of 2018, shortly thereafter. She's a geneticist down at University of Miami, correct?
Yes.
Fantastic. Okay, so between all those issues, when you started coming in, you were having the nausea and daily vomiting. You couldn't even hold food down. You had a pick in your arm for a while because you couldn't eat or drink fluids.
I couldn't drink either, yeah.
And then if I remember correctly, it kept getting infected, right? So they eventually had to take it out because you were
I
having
had
issues.
rashes.
You had rashes.
Yes,
Okay,
from
so
the adhesive.
from the adhesive. And obviously that's not sustainable. You need to eat food like a human being and not just live through a tube. Okay, so between all these medications and everything, in July 2018 when you started seeing us, you were still having pretty much most of these. And you also had severe weight loss at one point too, right? How much
Yes.
weight did you lose?
My story first started in January 1st of 2015. I woke up with a stomach virus and it just never cleared up. I lost 30 pounds in 6 weeks.
Wow, that's a big weight loss in 6 weeks. And you were down at how much? What were you weighing at the time?
I started at 160 and then I ended up at 130. My lowest was 100 and that was this past August in 2019.
In 2019, okay. And then, so last year, right after you were on the pick, and first we had tried, we started you off with acupuncture. We tried doing some different supplements and vitamins, but you couldn't hold anything down. You were throwing it all up, including food, even water. You couldn't even do drinks. So at that point, we realized you had a severe absorption issue.
Yes.
And you had already had an absorption issue. Your vitamin D was also chronically low, correct?
Yes, it was chronically average 23.
23, which is okay, that is below insufficiency. Okay. So we started at that time. I switched you to a Chinese herbal medicine tincture because you couldn't swallow liquids or the pills. And then we started doing vitamin injections, and we were doing a B12, B complex with some vitamin C in there, glutathione, and vitamin D. And within a couple months, can you tell us how that started going for you?
My energy level started spiking. I was able to join a water aerobics class. My brain fog and my memory started to clear. And
What about all the pain, all the stomach pain, seizures, all that stuff, headaches?
they all started to decrease. And I just started feeling even better and better.
And now, and you were able to start eating food and drinking like regular?
Yes, along with a couple medications.
Right. And then, so a few months after that, you got accepted to a program at Mass General, right, up in Boston, and they switched some medication. What did they put you on there?
Mirtazapine.
Okay, and that continued to help make the vomiting decrease. You already had
Yes.
some improvement. And then what medications are you on now?
The mirtazapine. I'm also on Creon for pancreatic enzymes to help absorb my food. And I'm also on cromolyn for my mast cells and Keppra for abdominal pain.
Okay, and at the Keppra at one point for the abdominal pain, you were taking how many per day?
4.
4, and now?
Once.
Okay, wow. So we've significantly decreased your medications, and I mean, night and day, you look like a completely different person.
Thank you.
No, you're welcome. Thank you for sharing this information with us. Is there anything else you want to add, or any other?
The exercise was a huge help too.
So Dr. Fergani had recommended Pilates initially, and now you're doing pelvic floor therapy, right? And water aerobics and stuff like that?
Yes, I also bike at home
Biking,
every day.
excellent. And you went from being pretty much disabled in your early 20s, and now you're working again too as well, right?
Yes, I just started work in January.
That is awesome. We are so, so happy for you. Thank you so much for sharing your story, and we really appreciate it and hope you continue to get better.
My pleasure.
All right, take care.